Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider.
Welcome to Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. Once again, I am your host. My name is Hope, and today co-hosting with me is Tara. And Tara's going to talk a little bit about what today's episode is about.
Hey there. So today we are going to talk about all things sleep. So whether it's that you're not getting enough sleep, you're tired all the time, you have someone that snores next to you that keeps you up all night, all those questions we're going to answer today.
Today, we have two guests with us. We have Brady Tucker and Jeff Walsh. They are from our pulmonology and sleep medicine departments. I'm going to give them the opportunity to tell us a little bit about themselves.
Yeah, I'm Brady Tucker. I've been at Tanner Clinic for 12 years this year. Pulmonary and sleep medicine, working with Dr. Alexander.
Yeah, so same department, same people. I've worked at Tanner Clinic for about 2.5 years, pulmonology and sleep medicine, just like Brady.
We're going to start out talking about just kind of common sleep struggles that a lot of people face. One thing that I hear a lot is I feel like I'm getting my full 8 hours of sleep, but I still feel tired when I wake up. So how does someone know that they are getting a good quality of sleep?
I think for the most part, if you wake up and you feel good, that's a good sign.
Yeah.
If you feel like you're getting enough sleep and you're doing all the things and you still don't feel good when you wake up or you're tired throughout the day, then certainly worth looking into.
Yeah.
A lot of people, I think, give themselves enough time to go to bed and be in bed for 8 hours, but they're not necessarily sleeping for that long.
I feel called out. And I was in bed and then I doom scroll for
yeah, there you go.
maybe a while.
So that's one thing we kind of look into is how you approach sleep.
Yeah.
And how long you actually sleep and obviously how you feel.
Yeah.
So with that, how many hours do you actually need to sleep? Because maybe some of us try to stay awake for as many hours as possible.
Yeah, it would be nice if we didn't have to sleep, right? We'd get a lot more done. The general recommendation is 7 to 9 hours. There's certainly a lot of information out there that would maybe argue against that, but I think recently we're finding more and more out about how important sleep is.
Yeah. I mean, personally, I love sleep. I would want to sleep more. If I could, I would, but I just can't. Life's too busy.
Yeah, if you felt better.
But I am the type of person that can literally sleep anytime.
So what you're advocating for is naps during the day, right? So
I am.
helpful if we are able to have a nap, if that could be built into a work day, would that be beneficial?
Bring back
And
siestas.
we actually prescribe naps for narcolepsy patients, but
No.
naps can be beneficial. Obviously, they can't be too long or too late. So if you're napping and that's impacting your ability to fall asleep at night, obviously that's problematic.
Yeah.
And kind of creates this vicious cycle where you're getting to sleep later, not sleeping as long, you're tired, you're napping, and it just gets worse and worse.
And
So
said
you're
how
saying I
long?
can't fall asleep at 5 and sleep until 8?
That would be a bad thing, probably.
I
if
I
you
have
can-
done
if
that.
you can swing it, then you're good. But
People are going to really learn about my
generally,
bad sleep.
most people, yeah, that would be a bad thing.
Okay.
I typically advise patients to keep naps to no more than 45 minutes. And
Interesting.
before 2 p.m.
Didn't Einstein take 20-minute naps? So
The power nap. Where did that come from? The 15-minute power nap? Because I feel like by the time 15 minutes is around, I barely fell asleep and then I woke up again. So how long am I actually sleeping? 5 minutes? It's going to do nothing for me.
Even though you don't sleep, just the act of trying to sleep is actually beneficial too, to kind of disconnect your brain and give you this little break from whatever's.
It's just a very relaxing moment for your body.
So it can kind of recharge you and de-stress even over a period of minutes.
A lot of people have a lot of stress. So what effect does that have on our sleep?
Stress is going to negatively impact your sleep. I know it's not so easy as saying don't be stressed and go to sleep, but if there are ways to kind of mitigate that, if you can find ways to set your worries aside, I do think that you're going to get a more restful night of sleep. Again, easier said than done. It's kind of cyclical though. It's hard. If you don't get enough sleep, you get more stressed. You get more stressed, you get worse quality sleep. So I think that it's important to try to find the time to set aside time to get the appropriate amount of sleep.
Yeah.
So
what you're saying is maybe we shouldn't be doom scrolling and seeing all the stressful things on social media before we go to sleep, or
I only watch fun puppy videos.
okay, so fun,
I think
but
I'm
really, even when regardless of what you're watching, being on your phone before you go to sleep, is that helpful or harmful?
probably harmful to some degree, but I think you'll find people who have no issue falling asleep after they've been on their phone. But that kind of goes back to something Brady said earlier. If you're using your time in bed to be on your phone, you're probably not getting the appropriate amount of sleep. That all being said, there is a light that is emitted from your phones, other screens, things like that, that's going to make it harder for your mind to shut off and go to sleep and get into good quality sleep too.
What if I turn the brightness all the way down on my phone? So it's like almost black.
Yeah, it might help a little bit.
Okay.
Some
I'm just really
phones-
trying to still be able to do it.
Yeah, it's the type of light, as far as I understand. I think some phones have ways to minimize the amount of blue light specifically that is emitted, but I still think it's there to some degree.
Yeah.
So,
do it at your own risk.
I mean, if you're sleeping well and you're feeling good,
I mean, I am always tired,
of
but
course, yeah. But if you're not feeling great, then you might want to make investments.
okay.
They say that 50% of sleep is learned. And so we do build habits towards sleep, and especially getting to sleep, right?
Yeah.
So one of the problematic areas with phone use is, like Jeff said, the blue light impacts your melatonin production. And so if you're lying in bed, you're like, I need to go to bed, but I'm not tired yet, so I'm just going to look at my phone. So again, it's one of those things that just kind of exacerbates the problem. So there's two aspects of it, the blue light, but then also just the stimulating effect of, especially like you mentioned, doom scrolling. So social media is designed to grab your attention, right?
Yeah.
And you don't want something that's grabbing your attention away from sleep. So again, when we, going back to the initial question of stress as well, I think it's pretty evident that women generally struggle more with stress as far as getting to sleep, just not being able to turn their brain off, right? Thinking about random things. So
Not me.
they find that, being on your phone or watching a show or listening to something can distract you enough until you feel like you're sleepy enough that you can fall asleep. But it's not the healthiest thing to do as far as our sleep's concerned. And so, again, when we run into an issue where somebody's having a hard time getting to sleep, we try to be really regimented about how they approach sleep. So no screen time. The recommendation is 2 hours before bedtime. There's kind of a risk category or quantification, I guess, of screens. So phones and social media are generally the worst, again, because they're very attention grabbing.
Mm-hmm.
TV's okay. Video games also are very stimulating, very attention grabbing. So it's like you're winding your brain up and then trying to do the opposite to get to sleep. So it's just not conducive to being able to fall asleep. So again, like I said, we lay it out like, okay, 2 hours before bedtime, I want you to do this. And it's a chore at first. It's painful. But
What am I supposed to do? Just lay there?
The point is, we want you to be bored out of your mind, that you'd rather sleep than sit and do nothing or whatever. But we implement, like, again, avoiding screen time, like a hot bath or shower is good at night, a hot drink's good at night to kind of warm up your core temperature and build a habit towards sleep so that your body knows, okay, it's time for me to start getting ready for bed. We use like sleep journaling. So if you have a hard time just not thinking about stuff, turning your brain off, then I have patients get a journal and just write whatever they're thinking about. It doesn't have to make any sense. It's not for them or anyone else to read, but just the act of thinking, writing, just allows you to kind of let those thoughts go and is more conducive to being able to fall asleep. And then if that doesn't work, I tell them to get a book that's boring, that they would rather sleep than read. Again, we're just trying to distract.
Taxes for dummies.
Yeah, exactly. We're just trying to distract your mind or whatever these distractions are that are getting in the way of sleep.
Yeah.
But yeah, screen's not great.
I knew you were going to say
there for a reason.
There's those apps that you can listen to. So you put in your AirPod and it's like the calming, sounds or white noise. Is that something that you would recommend?
Yeah, white noise, brown noise, I think is good. Mm-hmm.
There you go. I have a personal question as well. With the, work culture that we have, people either usually work out in the morning or they work out at night. And I am not a morning person. I never have been. I get up and I just do my best to get to work at a decent time, right? So I find that I tend to work out at night. And I was working out with my sister-in-law, and we had to go a little bit later because she was putting kids down to bed, things like that. We were going like 8 o'clock at night. And I thought that would make me not want to go to bed because I was like overstimulated. And I don't know if I'm just broken, but I did fall asleep pretty easily after that. So do you think that has an effect on how easily someone can fall asleep if they're like working out like really close to what time they're going to bed?
I definitely think that it can. It just comes down to whether it affects you or not. I think so. The way that I frame it is exercise is always good. Okay. As long as it's not significantly negatively impacting your sleep, then I certainly would say just exercise when you can exercise, right?
Yeah.
Now, if you go to bed and you're laid awake for hours at a time, and obviously that's going to create a problem, then certainly we'd have to adjust that schedule. And if you are doing more strenuous workouts close to bedtime, it may very well amp you up to the point where it takes a while to calm down and be able to wind down, relax, and fall asleep. So I think it depends on what you're doing, how impactful or strenuous it is, and then how close it is to bedtime.
All right, let's talk about snoring, because maybe there's someone in my house that maybe snores at night, and maybe smothering them with a pillow is not how to stop it. So tell me, 1, how do we stop snoring? And 2, is it indicative of a bigger problem?
Snoring is really common, right? And you'll see differing levels of very light snoring to very disruptive snoring, like it sounds like you experience at home.
It's not me.
Snoring can be a big deal. If it seems like the person's gasping for air or having issues breathing while they're sleeping, it could be indicative of sleep apnea. Snoring itself, though, occurs when the tissue basically between your nose and your mouth vibrates against the back of your throat, essentially. Ways to minimize that, there are some easier ones and harder ones. Sleep positioning is probably the biggest thing to help with snoring. If you or the person who sleep next to you snores a lot, side or stomach sleeping is going to help a lot. Okay. So most snoring occurs on the back just because gravity's going to pull that tissue easier to the back of your throat.
Just kick him right to a side. Got it. Okay.
Put something behind him so he can't roll over on his back. Snoring is also more common the more tired somebody is. So if you accumulate like a sleep deficit where you're not getting enough sleep and then you finally do on one night, if you're more fatigued that night and finally start to sleep better, you're going to snore more on that night. So again, easier said than done here, but if you can try to get a consistent amount of sleep each night, your snoring will be less overall.
So that's why I snore when I go to Disneyland, but like no other time. I only snore when I go to Disneyland because I get
really
so
tired.
exhausted.
Yeah, if you're walking around,
That makes me feel better.
shooting them, snore more there.
I've never snored, not once in my life. Never.
Knock on wood.
I definitely, when I get sick and congested, someone tells me that I snore, but that's it. And what about the strips?
So I feel like most stuff for sleep in general, there's kind of low risk with trying a lot of things, right? Like we talked about exercising too close to bedtime. If you do that and you can sleep fine, just keep going. But if you're having a hard time, you might want to switch things up. Same thing with nasal dilating strips, right? You can try those, minimal cost. If they help, go for it. If they don't, then you're not out too much money. There are other devices that go inside your mouth. I think, Brady, you've tried a few of these, or at least you know more brands than I do, but you could try it. If it works, awesome. If it doesn't, you're not.
What are you sticking in their mouth? Tell us about this device.
So they're mouth guards.
Okay.
They're called mandibular advancement devices. What they do is they pull your jaw forward. So again, going back to creating more space in the back of the throat, so you're less likely to snore. There's 1,000,001 different options out there. They're probably not all created equal. I have a list that I give to patients just because they come with at least a 30-day trial period or money back guarantee to try it.
Yeah.
And then we get a sense for whether they work or not. The best ones are custom made, manufactured, but they're really expensive. They're adjustable. So if we can use an over-the-counter option to get a feel for if they can tolerate it, if it works before we go to that step. And generally also that's only in relation to somebody with just snoring and not sleep apnea. So going back to the snoring side of things, it's estimated that about 70% of people who snore actually have sleep apnea. So there's a lot of people that snore that don't have sleep apnea, but if it's problematic, if it's bad enough that it's waking you up or a bed partner, if it's bad enough that they're sleeping in a different room or wearing earplugs or constantly waking up throughout the night, that's a pretty good indication we should get it checked out.
And you did. I sent him in for a sleep study, and he does have mild sleep apnea. So one of the other trends that I've heard is the taping the mouth. When you tape your mouth, is that beneficial for snoring or anything else?
It's a good question. So the research that has been done on mouth taping is not very promising. So
Okay.
mostly it's just anecdotal. People say, oh yeah, I did this and it worked. In the research or in the studies, it actually showed in a reasonably high percentage of the time it made it worse. So I would
Interesting.
dissuade you from using mouth tape.
For snoring or for anything else? Like, does that help with
for sleep
anything?
apnea. This is
For sleep
this
apnea.
this was specifically for sleep
Okay.
apnea. Yeah. So for snoring, yeah, it certainly could work. I mean, traditionally we've used chin strap. That's essentially the same concept.
Okay.
We can keep your mouth closed and keep you breathing through your nose. You're less likely to snore.
I have seen some crazy videos online though, and people will use like clear tape, and it looks insane. Like their whole mouth just, and like those are like some of my favorite videos, but it looks really scary. I'm like, I
Well,
don't
they're
think I would
saying
ever try that because it looks like they can't breathe.
Helps with lines, I've heard. 'Cause you're
Does
not, this is what I'm hearing. And maybe I have been taping my mouth at night because I'm of an age that starts to get those. But
That's why.
I do
So you won't
remember
get lines in your neck, but you'll just get like
something.
irritation. All over
Probably.
your
I'm going to get a rash eventually.
She's like
But I'm
waxing
using medical
her.
tape. I'm using medical tape. And I do remember in the middle of the night, I'll wake up and I just rip it off. But I'm too tired to think about it. But last night I kept it on all night.
I do have patients that say they want to try it. If they do, then there's a specific tape that I recommend, and it's cheap and
Yeah.
yeah, Medipore tape.
That's what I'm using. Okay. Well, that's good to know.
Usually I
I'm not
just
getting a
have
rash
them
yet.
Just put a strip right down the middle of your lips rather than covering your whole.
That's what I do.
Yeah, because that's scary looking. How are they breathing?
Yeah, I don't know how people can tolerate that.
I would wake up and I'd be like, I can't breathe.
Mm-hmm.
I'd like wake up out of my sleep.
Get this thing off.
And I'm a major mouth breather at night. So I'm trying to help with like just having a dry throat when you wake up. So we'll see. I've tried it for like a week and I've tore it off every night except for last night. So we'll see how it works out.
So we have been talking a little bit about about sleep apnea, but can you explain to someone like me who doesn't actually know anything what sleep apnea is?
Explain to me like I'm 5.
Sleep
like we're
apnea
35.
for dummies. Because I'm just here as a host. I'm not here as a medical professional. I'm speaking for the people.
So there's 2 types of sleep apnea: obstructive and central. I think probably 95% of people who have sleep apnea have obstructive sleep apnea. And it is just that. It's obstruction in the back of your airway. And that causes an abnormal drop in your oxygen and has this downstream effect, increases your pulse, heart rate, blood pressure over time. There's a lot of negative effects from sleep apnea. I joke, half jokingly, I guess, with patients at times that it's like you're trying to suffocate in your sleep. So it's not a good thing. Symptoms, snoring, we already talked about, especially if it's loud and disruptive. Waking up with headaches, waking up tired. Again, going back to our initial question of, I feel like I'm getting enough sleep, or I'm giving myself enough time to get enough sleep, but I'm still tired all the time. I'm tired when I wake up. So that's a symptom of sleep apnea as well. Again, going back to kind of the bed partner or somebody sleeping next to you, if they tell you like, I woke up last night and you weren't breathing and you were like gasping and irregular breathing in your sleep. And we'll have patients that come in and they have like video recordings of, usually it's, the wife bringing the husband in. And,
She's like, this is what you
dragging
sounded
him
like.
tooth and nail, and he's like, I don't know why I'm here. I'm fine. And she's like, this is why you're here. And yeah,
We have proof.
you can seriously look it up. It's pretty dramatic, and you can, it doesn't take very long. You look at that video and you can see, oh, that's probably not good for me.
Yeah.
And then the central sleep apneas, we don't really understand why that occurs or why that happens, but essentially it's like your brain doesn't tell your lungs to breathe. So again, it's still this abnormal drop in your oxygen due to irregular breathing at night. And there's different treatments depending on the type.
So what are those treatments for sleep apnea?
So treatment for sleep apnea depends a little bit on how bad it is. You alluded that your husband has mild sleep apnea. So if you've got mild sleep apnea, you've probably got more options. You can, again, focus on sleep positioning. Exercise and weight loss helps most things, especially sleep apnea. Brady talked about the oral appliances that can go in your mouth. Some of them do help mild sleep apnea.
Okay.
But again, some of those can get expensive the more kind of custom they are. CPAP is a great option. I think most people associate CPAP with sleep apnea almost exclusively. It's not the only option, But if you've got bad enough sleep apnea, it probably is gold standard. I think most people are also apprehensive about trying CPAP. And I would say most people who at least will give it a try do well and can feel really good within a few days to a week or two.
So if you don't know what CPAP is, explain to maybe some of our listeners what CPAP actually is.
So sleep apnea occurs when the tongue muscles relax at night. They block off your airspace. What CPAP does is it opens up your airway by using air pressure to push the tongue muscles out of the way, essentially.
And you just have the mask with the hose, right?
Yep. The device itself looks pretty standard across the board for the most part, but there are a lot of different mask types. So for patients who really don't want something around their mouth, there are nasal CPAPs if they're tolerated and work well. And there's a lot of options on masks.
That's good to know. Okay, so then maybe we've tried CPAP for a while and can't tolerate CPAP. Is there anything else that you can do?
Yeah, for sure. So the approach again is if we have a patient with moderate to severe sleep apnea, the gold standard is CPAP, CPAP BiPAP. There's a number of machines that we use. So we try to do everything we can to help a patient tolerate and use the machine because it's the best option. I think a big failure aspect of CPAP is just patients not being adequately prepared and knowing what to expect. And that's why we're here, really. So we see a lot of times where, say, primary care provider orders a sleep study. The sleep study says, put the patient on CPAP. They call up the patient, say, hey, we need to order you CPAP. These people are going to call you. So they end up with this equipment, this machine, and they're like, oh man, what do I even do with this? And they try it and it's miserable. It really is at first. It takes time to get used to. And so when we sit down with patients, we really try to lay it out for them like, hey, this is not going to be fun or easy. Nobody wants to use a CPAP. Nobody's knocking down our doors saying, please put me on CPAP, right? And I tell patients it will always be easier to not have to worry about the mask, but you got to think about the benefit. If doing this little thing helps you feel better when you wake up, feel better throughout the day, you can think clear, you're less tired, you're safer. There's a lot of benefits. At that point, it'll sell itself. Okay. But, again, there's a lot of people out there that don't or can't tolerate CPAP. So if we've exhausted all of our options and we just can't seem to make it work, generally the next best option is Inspire. Inspire is a surgically implanted device, generally implanted under the right collarbone. So you get 2 scars or incisions, one underneath the collarbone, one underneath the jawbone, and there's no mask. So that's a selling point. It's more convenient. It's easy to travel with, but at best it's about 70 to 80% as effective as the CPAP. And so you have a little remote that you turn it on before you go to sleep. And then as you inspire or breathe in, it stimulates the muscle in the back of your throat or your tongue to just stick forward a little bit. And so it just uses that stimulus to create that open space in the back of your throat rather than that air pressure.
Okay, so if you've been diagnosed with sleep apnea, but yet you feel like I'm feeling pretty good, why do I have to get a CPAP or why do I have to treat the sleep apnea?
I think over time, it can have some pretty bad effects. One of the biggest associations I see with sleep apnea is an increase in blood pressure. And if you look at that, that causes a whole slew of issues on its own. But specifically, patients who have severe sleep apnea over time increases risk for heart issues. So heart attacks, heart failure, irregular heart rhythms, as well as strokes, dementia, things like that. So a bunch of stuff you don't want. Obviously, you're not going to get those just because you don't treat it, but it does increase the risk of having those things occur. So as well as preventing car accidents. So a lot of people who've got sleep apnea, really tired and they just deal with it, but it increases the likelihood they'll fall asleep while driving. So.
And that puts a lot more people at risk.
For sure.
Yeah, there's a lot of downstream effects from untreated sleep apnea. So those are the biggest ones. Cardiovascular. So it's about risk reduction. We're treating a patient now to prevent heart attack, stroke 10, 20, 30 years down the road. And then the safety aspect. But yeah, cardiovascular, neurological, like dementia, neurocognitive decline. We get referrals for erectile dysfunction, for like Jeff said, arrhythmia, cardiac arrhythmia issues, headaches, chronic headaches. I've got a chart in my office that people will point to at times because it seems, what's the word? Ridiculous.
Yes, a little overwhelming.
Yeah, exaggerated for sure. Like, how can untreated sleep apnea contribute to cancer? That's one of the things on the list. It's like, it just doesn't seem like, wait, this seems blown out of proportion. But if you think about it, if you're not breathing during your sleep, your oxygen's dropping. Essentially, wherever your body is prone to problems, you're steering towards that. And so increased inflammation, a lot of important things happen during our sleep as far as replenishing our hormones, especially our stress hormone cortisol. So if you constantly have this fragmented or interrupted sleep, it throws your hormones off, and that just, again, contributes to increased inflammation, which contributes to a whole myriad of potential health issues.
So what they're saying is if your partner takes a video of you gasping for air in the middle of the night, maybe don't go kicking and screaming and just make an appointment, because there's a lot of things that could potentially happen as a result of not treating it.
Yeah, and I think people just go straight to CPAP, like, oh, there's no way I can do that. I mean, we spend a lot of our time convincing people, like, look, just let's try it, okay? There's a lot of options. We'll help you through it. We'll hold your hand. We'll make it as easy as possible. And seriously, weekly, I get people that come back. Again, it's usually guys that don't want to do it. They're just like, no, you're not going to tell me what to do, and that's fine. And obviously, we want to find the best treatment option that works for each patient, right? We're not certainly not in the business. It's not like we get any benefit from putting people on CPAP who don't want to be on CPAP, but.
I feel like a lot of people think that,
yeah. I mean, if you think about, instead of just focusing all on the negative aspect of it, like, oh, I've got to wear a mask, I've got this tube, I got, this machine that makes noise, and they're actually quite quiet, by the way.
I mean, I've
Your white noise fishing, right?
Yeah.
slept in the same room as someone with the CPAP, and they were like so concerned that it was going to bother me. They were like, I'm so sorry, I have this CPAP. Like, if it's bothering you, just let me know. And I was like, I slept fine.
Yeah.
I literally didn't even notice it.
A lot of noise.
Compared to somebody snoring.
Exactly. That's the thing.
Exactly.
So when we put a patient on therapy, the spouse or bed partner, we tell them, like, hey, you're initially going to wake up because you're not hearing them. You're so used to hearing them.
You're like, it's too quiet in here.
Yeah, exactly. So the
Like,
noise
you think they're not
solution,
breathing.
like I said, at least once a week, I get somebody that comes back in, and they thank me, like, for convincing them to just give it a try, because they're like, and then they're saying, I wish I would have done this 10 years ago. I can't believe how much better I'd feel. I'm sleeping so much better. My bruises all over my ribs are gone from elbows.
You're probably going to have a better relationship because of it. I've heard stories.
I think the takeaway, is if there's any question, it never hurts to just come in and let us go over everything and see if we can help.
Yeah.
I even say, if you've tried CPAP in the past and haven't done well on it and just didn't work out the first time, it's worth rediscussing.
Yeah.
There's stuff we can try to really.
I agree.
There's multiple options that you guys can try out and adjust.
I mean, it's pretty, CPAP, its concept is pretty basic, but there are some complexities that can arise as well. Like Brady mentioned earlier, there's something called central sleep apnea. On a rare occasion, you'll see some of that on CPAP. And so patients might say that they feel like they're struggling and suffocating, and it could be it's because it's causing the other issue, if that makes sense. So, and you wouldn't know that unless you had somebody look at it closer with you. So that's not all that common, mind you. But
yeah, I agree.
No looking it up on the internet and self-diagnosing and trying to treat it with mouth tape and
just go get
maybe that would help. I don't know.
Mine's because I'm vain, but yeah.
But the internet is not a doctor. They didn't go to school, most of them. They can just write whatever they want on there. That's like basically, I feel like every episode we're like, don't go to the internet for answers to things. I mean, maybe it would help you say, maybe I do have sleep apnea, but at that point you should go and make an appointment and not try and self-treat, I would say.
That's a good point. I mean, I think it's not a bad thing to, try to learn and educate yourself, but yeah, if it's
from the right sources.
Yeah.
Are there things that put someone at more of a risk for developing sleep apnea? Some things that we could potentially avoid or change? Maybe give ourselves less of a risk of that?
I think the biggest modifiable risk factor for sleep apnea is weight. It's not as simple as saying, so when you have sleep apnea, we give you a score of how many vents per hour, how many times per hour does your airway get blocked off? And it's not as easy as saying if you lose this amount of weight, you'll have a reduction by this amount, because everybody is so different. But generally speaking, weight is probably the biggest modifiable risk factor. So weight loss is helpful for reduction in sleep apnea, as well as exercise in general. If you exercise but you're not losing weight, it is still helpful for sleep apnea. So
Yeah, there's three things overall that we term as modifiable risk factors: exercise, weight loss, and smoking cessation. The biggest risk factors is weight. So, I mean, it depends on where you carry your weight too. So neck circumference size is a risk factor that we ask patients about, like collar size. So 15 inches or greater in women, 17 inches or greater in men.
We don't have to think about that. I've never measured my collar size before.
There's what's called the Mallampati score. So how crowded the back of your throat is. When we look at the back of your throat, that anesthesiologists look at before surgery. So, anatomy, genetics certainly play into it, things that you don't have control over. But again, we tell patients the things that we do have control over, mainly those three: exercise, weight loss, smoking cessation.
Yeah. You talked about how exercising in general can help. I understand maybe weight loss with like the neck circumference, the volume, things like that. How is exercise beneficial to helping with
That's a good
that?
question. I don't know the exacts on that. If I had to guess, it would just be increase in muscle tone.
Okay.
Your muscles are tighter and you have less. I mean, the more relaxed your body is, the more the sleep apnea is going to come in.
That makes sense.
I think that's exactly it. So there's another treatment option that we haven't talked about. There are some surgical options for treating sleep apnea. We'll refer patients to ENT.
Mhm.
Now, one of the tricky things about the surgeries is, so a 50% reduction in that index that Jeff talked about, apnea-hypopnea index, is considered a successful surgery.
Okay.
If you're going to go have surgery for something, you would hope that it would cure you of the problem. So it's not the case with these. And then another thing that I see in patients is they'll go have the surgery and they'll actually have a good response, especially in young men, 20s, 30s that are diagnosed. They're like, there's no way I'm going to wear a CPAP or whatever. So we find them another option, which is fine. But 5-10 years later, I'll find them coming back in and we'll retest them. And sure enough, their numbers are bad again, even after the surgery. And I think it goes directly related to that exercise component. So they have the surgery, but they don't change their lifestyle. That tissue, even though it was once removed, can then again become kind of slack, so to speak.
Yeah.
And you can present with the problem again, versus someone who has the surgery, who exercises consistently and maintains that muscle tone. They're much less likely to have that, worsening or progression over time. So the surgery, there's a couple of them. There's one called an airlift procedure. It's a hyoid suspension. So there's two incisions under the neck. They basically just loop a suture around the hyoid bone to pull that tissue out of the airway. So it creates a bigger airway. I think the most effective and consistently used one, but it's also more invasive, is called a modified EP3 or uvulopalatal pharyngoplasty. Kind of mouthful.
I was going to say, that's a long word.
So they take the uvula dangly guy out in the back of your throat, tonsils, adenoids, tonsillar pillars. They have a special laser, CO2 laser. I believe it's CO2 laser. They shave the base of the tongue. So they kind of just take everything out at the back of the throat that you don't.
It's all about reducing that volume in there.
Resect the soft palate. And
Wow.
yeah, it's the most, all-encompassing or invasive surgical option for sleep apnea. There is another one that's much, much less common, where they actually pull the whole face forward. But
We get a facelift.
I think that's the
Facelift?
opposite of a facelift.
That's
Oh, forward?
Forward.
Oh, I
It's
misunderstood.
very rare.
That's a face forward.
pretty
Kind of
intense.
pull your jaw forward.
Yeah, they essentially seriously detach the front of your face and move it forward. Yeah.
Oh,
Wow.
Pretty crazy.
That's fun.
I think we'll go with the machine. CPAP.
Go.
So going back to that point though too, before CPAP was available, sleep apnea patients got trachs. So that's another thing I tell patient, like, you don't want to use your CPAP. That's great. You know what we used to do? We used to put a hole in your neck.
Oh my gosh.
So that again just kind of goes to show it's it's a serious issue. It's something
Yeah.
you should take seriously. And it's compared to a hole in your neck,
Yeah.
CPAP's not that
Yeah.
bad.
Or taking your whole face off.
Yeah.
Sorry.
And I still have some patients from that time, trach patients that we treat for sleep apnea.
So when did they stop doing that then?
Well,
I mean,
CPAP
if you don't know the exact.
CPAP was developed in the late 80s, mid to late 80s in Australia. So shortly after that, I don't know. I'm trying to think of this patient in particular, if I can remember. But it was around that time frame. Yeah.
Wow.
So yeah, they're definitely few and far between now, but they're still out there.
Thank you so much for coming on here, both of you. I learned a lot. I always learn a lot. I want to put it out there for anyone watching or listening. These two are so awesome. You've heard today how much they know, how knowledgeable they are, and how much they can help you. They are accepting patients. It doesn't take very long for you to be seen by them. So I think it's totally worth your time to call and make an appointment to be seen with them so that they can help you get the best sleep and be the healthiest version of you that you can be. Thank you for listening. We encourage you to follow us on our social media to keep up with our future episodes and topics that we will be covering. That way you can submit your own questions. So follow us on our Tanner Clinic social medias and keep up to date with that. And we will see you next time.